how anatomical differences can affect muscular imbalances is that when, for example, a person has one hip bone or nominate bone smaller than the other, and I've brought a model so that you can see how that works, is that when, for example, a person sits down, here's the model here, my little 2.5 dimensional model, is that when the person sits down on a surface, that those ischial tuberosities contact the surface, and then that causes the sacrum to tip a little bit and to tip downward. And because the sacrum sets the base for the spine to come off of, then the spine comes off of at an angle. And because there's these mechanisms in our body where the eyes and the ears want to be as level to the horizon as possible, then the body begins to tilt the spine back or causes scoliosis to occur in an attempt to right the body. And so that's how muscular imbalances can affect, or anatomical imbalances can affect muscular imbalances. And so what I'm looking for specifically are two different kinds of anatomical differences. One is when the person is standing, we're looking at anatomical differences in both the hips, that hemipelvis where one innominate bone is smaller than the other, and anatomical leg length differences where literally one bone can be longer than the other or smaller than the other, or we can have issues like, for example, the femoral neck, how the neck of the femur where it meets the little ball tips into the pelvis, so to speak, and that angle can be a little bit different. So we look at those things for the standing position, and then in the seated position we look specifically for the hemipelvis. Well, what massage therapists can do to help with this issue is first to look for it, to assess for it, to see if these anatomical differences are present in the body, because part of our work includes structuring our touch, and we need to know whether or not there are muscular imbalances or anatomical imbalances. And once we figure that out, then we can begin a treatment protocol to determine whether or not it's appropriate for a person to wear a lift or to sit on a lift. Like for this particular seminar, what I did was teach only the seated protocols. And so what I mean by a lift is just taking a little bit of rubber or some other surface like a checkbook with the appropriate amount of checks in it, or getting this little guy here and sitting on that in terms of, and actually having the practitioner fit the person for a lift. And then from there, we suggest to our clients whether or not it's appropriate for them to wear the lift, and they make the decision to do that. What massage therapists need to know in order to stay within their scope of practice is first they need to know their scope of practice. It's important because it varies from state to state. And so we want to make sure that the individual knows what their scope of practice is. Most states allow for client education, and that's what we're providing to our clients is education as to what they can do to treat themselves. All we're doing is providing them information as to what they can do to treat themselves, and then it's up to the individual client to decide if they want to do that or not. And that's the main thing. The other thing that we're doing is really keeping in mind that what we're doing is soft tissue work. Even though there's a part of this that's about balancing the bones, what we're trying to do is really see what the soft tissue response is. And so, for example, when we are fitting a person for a lift, yes, we're looking at helping to balance the bones a little bit, but then we're looking for what I call a soft tissue response, meaning that these righting reactions or these mechanisms that help right the body in a lot of ways are muscularly based. And so we measure the ears, the external acoustic meatus, to see if that gets level, because the soft tissues will pull on those temporal bones in order to level those ears, and that's where the labyrinth of the ear is, which is the balance center of the body that the body tries to work with. So our work is really soft tissue, and so if you keep that in mind, that we are working with the soft tissue, really seeing what's going on with that in order to, and then we use the bones as a handle to help us figure that out. But also along with that, we want to make sure that the individual is staying within their scope by only suggesting, Also not talking about it in terms of what the nature of that is, because that's what a diagnosis is it's the nature of what a disease is or an injury or whatever. We avoid that language because that's not up for us to determine. But if all we're doing is helping the body to find soft tissue balance, and we make that suggestion to the client to determine for themselves what it is that they want to do with that, then the practitioner is staying within the scope of practice.